Well, trauma is all about accidents, as you all know, and 17th October is celebrated as the World Trauma Day. Now, there's nothing to celebrate about trauma, but then it is just a means of creating an awareness about how to prevent road accidents, and if at all there is an accident, then how to go about treating it. Well, it has two different issues in it. One is about prevention. So, prevention is all about following traffic rules, wearing your seat belts, wearing your helmets always without fail. And treatment is all about taking the trauma victim or shifting the accident victim immediately, as soon as possible, to a well-equipped trauma center within the golden hour. So this golden hour concept is extremely important. It has stood the test of time. What is a golden hour? It just means that the very first hour from the time of the injury is called as the golden hour, because if a victim gets proper treatment, however serious the accident or injuries are, not only his chances of survival increase, but his chances of full and functional recovery are definitely high when you see to it that a trauma victim is treated within the golden hour. So prevent accidents, and if at all you see an accident, call an ambulance as soon as possible and shift to a hospital within the very first hour.
डॉक्टर, कोणती लक्षणं आढळल्यानंतर आम्ही तुमच्याकडे लगेच आले पाहिजे?
प्लास्टर लावल्यानंतर जर आपल्याला खूप वेदना होत असेल आणि त्या वेदनाशामक गोळ्या घेऊन सुद्धा थांबत नसेल, तर तुम्ही डॉक्टरांकडे त्वरित आलं पाहिजे. नंबर 2, जर तुमच्या हाताची बोटांची हालचाल जर कमी होत असेल आणि जी पहिल्या इतकी होत नसेल, तरी सुद्धा तुम्ही डॉक्टरांशी त्वरित संपर्क साधला पाहिजे. तुमच्या हाताच्या किंवा पायाच्या बोटांना समजा बधीरपणा आला किंवा त्याला कंटिन्युअसली कायम मुंग्या येत राहिल्या, तर तुम्ही वैद्यकीय मदत लगेच घेतली पाहिजे. नंबर 4, जर तुमच्या बोटांचा किंवा नखांचा रंग बदलला आणि ते काळनिळे पडले, तरी सुद्धा तुम्ही डॉक्टरांकडे इमिजिएटली तुम्ही जायला पाहिजे, की ते प्लास्टर काढता आलं पाहिजे किंवा ते ऍडजस्ट करता आलं पाहिजे हे त्यांना विचारलं पाहिजे. किंवा तुमच्याकडनं चुकून ते प्लास्टर कम्प्लीट ओलं झालं असेल, तर आतल्या स्किनला त्रास होत असेल किंवा आतल्या ऑपरेशनच्या पार्टला जर इजा झाली असेल, तर ते तुम्ही डॉक्टरकडे लगेच जाऊन बदलले पाहिजे.
One important point to mention is to not to panic in case of any injury to either of these extremes of our population. In case there is an injury, then you, like I said, you can just use a splint or a sling if it is an upper limb, or you can use a splint for the lower limb, and try to arrange or call for an ambulance so that the patient can reach the hospital. Once he's in the hospital, at Sancheti hospital, we have a specialized team for pediatric trauma as well as a specialized team for geriatric trauma. So the pediatric fractures are an entirely different set of injuries, and they are not corresponding or correlating to the adult counterparts of the same fractures. So we have a specialist, experienced senior pediatric orthopedic surgeon who is well renowned, and he is well experienced in treating all forms of pediatric trauma with excellent results. At the same time, geriatric patients, not only do they require treatment for the injuries post-fall, but prevention of these injuries is what our prime focus is. So we have a geriatric fall prevention OPD where a trained geriatric physician counsels the patients, advises the patients. Simple tests like improving the bone density or the strength of the bones will also go a long way in preventing the fracture following a fall. So I would highly recommend that any person above the age of 60 or 65 gets the bone density checked at least once a year, if not once in 2 years, takes adequate supplements of calcium and vitamin D to ensure that their bones are healthy and strong, and they do not end up getting any of these fractures due to falls.